professional. Oh, 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 oh. A chance with a professional. With Martin Sobu. A chance with a professional. Oh, 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 oh. A chance with a professional. With Martin Sobu.
Do you think that Baba Obasanjo could be on the stage while these Boko Haram people are doing what they are doing?
The objective of the private organization is slightly different from...
Nigeria is the most important country
of education. The collapse of culture in Nigeria. Even with cheating, we can't pass. We've not done enough. There's still more. Join us.
And you never regret that you did.
For so long, we've had Nigerians practicing abroad, and for so long we have featured such professionals on this show. Today, we are going to be taking a look once again on medical practice, but of course a bit of good governance. So today on the show, we are going to be having another prominent Nigerian living abroad talk to us about these issues. My name is Martin Sobu, and this is A Chat to the Professional. We are going to take a short break now, and we will be back. My guest today, a prominent Nigerian resident in the United Kingdom. He actually is a consultant gynecologist who started his career in Nigeria and thereafter traveled to the UK for further studies, and eventually decided to settle for practice. It is now my pleasure to welcome to the show Dr. Emeka Oloto. Doctor, you're welcome to the show.
Thank you very much.
Yes, you have lived and practiced in the United Kingdom for some years now. Do you want to share your experience with us? I mean, I'm not asking you to compare infrastructure here, but at least, you know, basic professional procedures and practice. You want to share that with us?
Well, thank you very much. As you rightly pointed out, my initial training started in Nigeria, and not just the initial training as an undergraduate, but also I did part of my postgraduate training in Nigeria at the University of Benin Teaching Hospital, getting to the level of senior registrar before going to UK. And when I got to UK, I started all over again from the level of SHO, senior house officer, through to the level of registrar, then to senior registrar, and finally as a consultant. So it was a long journey, but it was an experience that made me who I am today. Now, the main difference between my experience in Nigeria and in UK is the overall infrastructure is different. The way and manner patients and doctors interact is different. I put it to you that in Nigeria, sadly, many of our patients think that doctors are gods, and that once they say something, it must be right. Now, in UK, doctors are challenged to be able to defend whatever prescription you make. It is the patient's right to ask questions about their care. And as a doctor, you have an obligation, first and foremost, to your patients, and anything else can follow. Now, if you have your patients, you should be able to make sure that you devote all your time and attention to your patients. So if you, for instance, are appointed as a consultant, you don't start your work doing private practice. You start your work by doing what you're paid for first and foremost, and doing it well. Yes, some people carry out private practice, but it's under a clear rule of engagement. That rule of engagement is missing in our system. And I think it's important that one of the things that hopefully we can bring to Nigerian setting is trying to encourage the patients to be able to ask questions, trying to make sure that the curriculum and the training has a social component to it, that makes a doctor the servant of the patients, not the other way around. And that is really, in a nutshell, the main difference between what happens in UK and what happens here in terms of the day-to-day practice. I'm not talking about the facilities. We can not at this stage be comparing with a country that have been developed for over 300 years, but we can do better with what we've got. We can do better by making sure that the environment that we work in is appropriate for doctors and the patients. Okay, when I was living in Nigeria, I had the intention to acquire my postgraduate training, get my membership of the Royal College of Obstetricians and Gynaecologists, and come back to Nigeria. But things change along the line, because the more skill you acquire, the more you're finding out that back home you will not be able to put those skills into practice.
Because you don't have the facilities.
Because the facilities are not there. And therefore, it is not a one-way traffic. I know many Nigerians, many colleagues who work in UK and certainly in the US as well, who are really keen to make some contribution to the country. But what contribution can you make in an environment where the governance arrangement does not make it possible for the infrastructure to work? You need electricity, you need water, and you need a functioning hospital for people to actually put those skills into practice. Otherwise, you just be redundant. And I don't know anybody who wants to just acquire skills and do nothing with it. Sure. Then you would have not have bothered in the first instance. So that is really, in a nutshell, what I may say is the main difference and the challenges facing us in Nigeria at the present time.
You just mentioned something that is very critical, and that is, if you like, patient awareness. In Nigeria, for instance, patients are attended to by physicians, drugs prescribed and dispensed, and in most cases, the labels for such drugs or medications are removed. And what now happens is that should there be an emergency, such a patient is rushed to a different hospital or facility, and it now becomes difficult for the new doctor to have enough information that could help in attending to the patient. So how can we begin to engage the NMA, the Nigerian Medical Association, for instance, and other relevant professionals involved in administration of medicine, to ensure that patients are aware of their state of health and possibly the nature of treatment being administered?
Well, I think most doctors and nurses that I know do their best for the interest of the patient. But like any group, you will find exceptions. And some of those exceptions may be either because of the environment in which they practice and the law governing the practice in that country. The Nigerian Medical Association cannot work in isolation. We are in a society where you do not have control of the way drugs are dispensed. So when you see some doctors giving medications and removing the label, you could look at it in two ways. One way you may say, okay, it's trying its best to minimize the risk of self-prescription.
Sure.
Because we know that self-medication is rampant.
Very dangerous.
And very often very dangerous. And when you give medication to patients, as soon as they have anything remotely resembling that symptom, they will go and buy that medication. So that is perhaps a positive aspect of removing labels. But it doesn't excuse not telling the patient what exactly you give them. It doesn't excuse perhaps giving somebody paracetamol and pretending that you're giving them something magical to cure them. So that is deceit, and that is really will be frowned upon by any sensible medical organization. So the challenge is really not for the BMA alone. It's the BMA working with the health ministry to ensure that you have a clear control of the medications that are imported into this country. We have a number of medications that are fake. We heard about one minister who did her best to control drugs in the country, but we still know that drugs are flying in from everywhere. So the way to do it is, as part of the curriculum for students, that they are trained about the need to explain to your patients why you're giving what and what exactly you're giving to the patient. You cannot have control over what the patient does after all, but you have to do your own bit. You cannot just say just because the patient is likely to go and buy it some other time, that's an excuse not to tell her exactly or him exactly what the situations are and why you're giving that medication, and an advice as to what to do in future should you have any similar problem. I think that will be the starting point, is really changing the curriculum, making sure that our training is better, and engaging with the various organizations, the Nursing Council, the Nigerian Medical Association, and other allied bodies, that together you can make sure that the curriculum that is prescribed is adequate for the country and fit for purpose.
Thank you so much. Let's move into health management. In Nigeria, we have witnessed incessant strikes by doctors and other health workers due to various forms of disagreement with government. One of which is the issue of who becomes or remains the chief executive of a hospital. How can we begin a process that ensures that whilst the chief medical director of a hospital is occupied, or rather is a position occupied by a qualified medical doctor, the hospital management is left in the hands of persons who would have undergone training in hospital administration, as witnessed in other climes, you know, rather than a situation where if you are not a medical doctor, you cannot be the head of administration of a hospital. What would be your opinion on this, and how can we move forward going from here?
I think strike by any organization that will cause problem to the country is regrettable at any level. And certainly for the medical profession, our own strike in any form or shape involves life. And anything that will compromise life goes contrary to the whole ethics of our training. But the reality is that you are in a country where the doctors, the nurses, and others who practice medicine live in the same society. And unfortunately, corruption is endemic in the country, and because of the level of corruption in the country, appropriate investments are not being made in the appropriate health sector. And part of that investment is human investment. For the 24 years that I practiced in UK, I have not had 1 month that I was not paid salary. So if you're going to put in your best, at the end of the day, you'll be able to at least have your daily meal. How do you expect a doctor or a nurse for that matter, or a teacher or anybody who is working and not being paid to put in his or her best? I'm not trying in any form or shape to justify strike. I'm just trying to point out that there are areas in the whole economy, in the whole system, that is predisposing to some of these strikes. So the summary really is that strike of any form should not be necessary if there is equity in access, if there is obvious governance arrangement that makes it impossible for people to strike, and that makes it impossible for there to be a need for strike. Because why should there be a strike if you have the facilities to work and your pay salary at the end of the day? Why should you ever dream of striking? And if you're buying from the same market, why will it be right that certain professions, say politicians, are paid so much, or you hear that they're paid so much, and yet the professionals, the doctors, the nurses, the teachers, buying from the same market, are struggling to get their salaries? And when they do, people, the governors and others are being praised that they are paying salary for doing exactly what they're elected to do. Obviously, I'm not speaking on behalf of BMA. NMA. This is Nigeria. I'm not speaking on behalf of the Nigerian Medical Association, and I'm not conversant with their demand in that direction. I can only tell you what happens in the UK and tell you why I believe that if it is indeed their demand, that it is inappropriate. One is that in UK, whether you're a nurse or a doctor or any other profession, if you want to become the chief executive of a hospital, you apply for it, you're interviewed for it, and if you're the most qualified, you're appointed. So, you know, I was once working in a trust where the chief executive of the trust was a nurse. So, and you know, the trust was well run. So you don't have to be a doctor to be able to run a hospital properly. And even within the medical system, I think I want you to get two things clear. There is a difference between medical director of a hospital and chief executive of a hospital.
That's the point.
So the chief executive of the hospital is the overall boss of the hospital. And that can be a doctor, and that can be anybody. It can come from any profession and from any trade. But the medical director of a hospital has to be medical. That's why it's called medical director.
Of course.
Director.
Yeah, of course. We are not contesting in any way. That's why I said the trained doctors should be the chief medical directors. But the chief executive officers of these health institutions must not be medical doctors. As far as I'm concerned, I don't think if we continue that way, you know, we'll get it right.
Well, we cannot get it right because first and foremost, very few doctors are actually trained to be managers. And therefore, if you're a doctor that is trained in management, that have the expertise to be a chief executive of a hospital, there's no reason why a doctor should not be that person. It's also the case that if you are a nurse who is trained, who has the skill, who has the background to be able to be the chief executive of that hospital, that person should be. So it does not have to be a doctor. Actually, people can come from non-medical background completely to be the chief executive of a hospital. And we have seen instances of that in UK, and that does not in any way compromise the way the system works.
Now, bringing it down home, a number of Nigerian professionals practice abroad. They do very well in their countries of residence, distinguishing themselves in their various fields of endeavor. Excuse me. Unfortunately, when once they are challenged down home with same responsibility, you begin to see a drift and things are done in same wrong ways that we criticize. How can we begin to ensure compliance to international best practices by our people to ensure that good governance is enthroned in our society for the benefit of our people?
Well, many doctors who are abroad today, who are Nigerians, and especially from our state, Enugu State, many of them have excelled in their respective specialties. And given the opportunity, I know that many of them would like to actually utilize those skills locally, and that is in Nigeria. However, for you to be able to utilize that skill, you have to have the facilities to do so. And if anybody comes back and wants to practice differently from what the person has learned, then the whole purpose of the person's training is defeated. And that is why many cannot come back or do not wish to come back, because they just feel that they can't fit in the system. They don't want to join the so-called bandwagon of trying to practice deceitful medicine. They want to practice good medicine. They want to practice medicine in an appropriate facility, and they want to make sure that what they have learned abroad they can bring home. But there are a lot of obstacles to that. So many people are really prepared to do so. They know the challenges, but they have to work with those who are on the ground to achieve that. You can't just say, oh, I'm coming from abroad and I'm coming here to prescribe to you what happens abroad. You need to understand that the circumstance is different, the training is different, the education of the population is different. Therefore, working with colleagues who are in the system, it will be possible to change the way we look at the services. and it will be possible to ensure that those practices or skills people have acquired abroad can be transferred to the country. So if anybody is returning and joining the bandwagon, well, certainly somebody like myself will not be one of those.
Okay, Doctor, we appreciate your comments. Now, you came all the way from the United Kingdom with a number of professional colleagues to participate in a conference that seeks to enthrone good governance, particularly in Enugu, your home state. What is the motivation?
Okay, I think I've attended this conference as a representative of the UK branch of the Enugu Professionals for Good Governance. I chair that group in United Kingdom, and I came with about 4 other colleagues, so we're 5 in number that attended the conference. And our motivation was simple, that when you think about your own village and you think in terms of your own people, you ask yourself, how can you impact on their lives, and what exactly is happening in the system? If you look at the 3 arms of the government, you have the executive, the legislative arm, and of course the judiciary. Now, in my town, Ibagwani, things have not changed much for many years. For the population, we used to have pipe-borne water during the military regime, and for about 20-something years that we had the Enugu State, we don't have any such infrastructure, and I'm sure that that is the case in many other places. And it's not because the facilities or the money, we know that the money is limited, but we know that if you utilize that money well, then it's going to probably make the population actually get the dividends of democracy. So for our group, our own aim was to work with colleagues all over the world to see how we can make our own contribution to bringing about effective and good governance in Enugu State. We're not suggesting that there has not been any governance or that something have all been wrong. No, far from it. There have been a lot of progress, and we think that we could still, the state can still do better. And we're no longer thinking about all that the state can do for you, but you think about what you can do for the state. And the starting point would be to find a forum that can work with the government and other arms of the government to bring about rule of law, bring about a lot of structure in place that makes it possible to bring about what you call good governance. Because when you talk about good governance, you're thinking in terms of effective participation. You're thinking in terms of the dividend of democracy getting to the common man. You're thinking in terms of transparency. You're making sure that you eliminate corruption. You want to have what you may regard as a democracy that is devoid of a one-party state, and that means effective opposition. It's only when you have all that kind of structure in place that you'll be able to deliver good governance. And therefore, I have come with my colleagues to work with other colleagues all over the world to see how best we can contribute to the governance arrangement in the state. How we can work with the outgoing administration, and how we can work with incoming administration, and indeed the administration after them, to make sure that Enugu State will be a state that most people will be proud of to work in, and where individuals and citizens will be proud because they can see that they're electing leaders who are there to serve them, not leaders who are being served by them.
Thank you very much. Now, after the conference, are you encouraged that this will work?
I think I had my doubts when we started, and I had my doubts when we set off. But I'm going home more than ever determined, because I have seen the passion of professionals from all aspects of Enugu State, the 3 geopolitical zones, from different parts of the country, making effective contribution. It is the kind of conference that I never expected was going to happen, and even if it happened, that they will be able to come out with significant decisions. And I was particularly delighted that everybody seemed to be singing from the same hymn sheet. The determination was palpable. The desire to participate was palpable. But more importantly, the desire not to just wait for politicians to organize you or fund you. The desire for individuals to put in their own money for the state to make sure that the governance is a reality. And if everybody is going away that way, I think what we're going to do now is to mobilize more people from the state, more professionals from our state. When Seth and I go back to UK, the 12-man executive council is going to work around the clock to mobilize more professionals from Enugu State towards this cause. And that is the cause of good governance. So the summary is that it was a very successful Congress, a lot more than I had anticipated. My doubts were completely wiped out, and I'm now determined more than ever before to make sure that good governance becomes a reality in Enugu State.
All right, thank you very much, Dr. Oloto, for sharing your thoughts with us on a number of issues, including good governance, particularly as it affects Enugu State.
Thank you very much.
Thank you. Alright viewers, I'm afraid that's the much we can take on the show Chat to the Professional today. You will agree with me that Dr. Oloto indeed is a renowned professional who is making us proud in the UK. Like I had introduced him, a consultant gynecologist. And come next week, hopefully, we shall be having another professional come talk to us about a different issue. I remember Martin Sobu now saying stay blessed, and I'll see you again.
A chat with a professional with Martin Sobu. A chat with a professional. A chat with a professional with Martin Sobu. A chat with a professional.